Endocrinology is an area of internal medicine and pediatrics that is dedicated to hormones. Now, that doesn't mean that every disease that an endocrinologist takes care of is hormonal, but we generally dedicate our lives to making sure that the hormonal system is balanced. The most common disease in endocrinology is diabetes. And within diabetes, the most common type of diabetes is type 2 diabetes, which is usually related to being overweight and having a relatively poor lifestyle. Nevertheless, there are lots of people that are affected by type 2 diabetes that have led healthy lives and they just have the genetics for it. In our country, currently, the CDC states that there is over 30 million people that have diabetes. That's close to 10% of the population. It is one of the most costly diseases. The complications of diabetes, which go from neuropathy to blindness and accelerated heart disease, can be prevented. And they can be prevented not only by having good control, but by helping a patient modify to their style, their lifestyle, so that it becomes healthy. Another disease that endocrinology encompasses that is quite common is thyroid disease. And there are a lot of misconceptions about thyroid disease. You can have an overactive thyroid or an underactive thyroid, and obviously they're treated differently, but not everything is what it seems. So, for example, a lot of people that have an underactive thyroid attribute that to the fact that they've gained 40 or 50 pounds. And really, in effect, the studies have shown that an underactive thyroid is only responsible for maybe about 8 to 10 pounds of weight gain. Hyperthyroidism is a disease that can be quite disabling. It's when the thyroid produces too much thyroid hormone. Some patients have described such disease as feeling like they are a car and somebody is pressing on the brakes and the accelerator at the same time. They tend to be very nervous, have insomnia, heat intolerance, and definitely palpitations. Both of these diseases, hypothyroidism and hyperthyroidism, are treatable and quite often curable. Other rare diseases that are treated within endocrinology are short stature, irregular menstrual periods, and lack of libido in males. The low testosterone syndrome is a very complex syndrome. It needs to be studied because once a person is to take testosterone, very likely they will have to do so for life. These are not temporary illnesses. Infertility is part of endocrinology. Very often there are gynecologists that specialize in endocrinology, specifically in infertility. Another common entity is when a woman develops facial hair, such as this. Quite not exaggerated, but these can be the symptoms of something that is much larger and is going on silently. Endocrinology also deals with osteoporosis as well as disorders of your cholesterol. And now endocrinology has the tools to be able to diagnose and treat and collaborate with your primary care physician in getting you to be better, healthier, and hopefully have a long, productive, happy life. Thank you.